Everyone, I'd like to call this meeting of the Cook County Public Health and Human Services Board to order on this chilly Tuesday, January 21st at 8:36 a.m. The first thing is to get our officers elected. It's both the chair and the vice chair. I'm willing to serve again as chair if there's another commissioner that would like, or Rana is a board commissioner. If you would like to serve as chair, I'd welcome that. Is there any interest here?
No, I would nominate you.
Okay.
I'll second that motion.
Are there any other nominations? Including self-nominations. Are there any other nominations? Are there any other nominations? Hearing none. All in favor for Commissioner Mills as chair of the PHHS Board, signify by saying aye.
Aye.
Aye. Opposed? Motion passes unanimously.
Congratulations.
Thank you. Moving on to the vice chair position. May I ask for any interest there?
This is your chance.
Well,
I'd be happy to serve as vice chair.
Thank you, Commissioner Sullivan. I'll nominate Commissioner Sullivan to serve as vice chair. Are there any other nominations? Are there any other nominations? Are there any other nominations? Hearing none, I'll close the nominations and ask for a vote for Commissioner Sullivan as vice chair for the PHHS Board. All those in favor, signify by saying aye. Aye. Opposed? Motion passes unanimously. Or election passes unanimously.
And just a heads up, Commissioner, I'm getting a note from Melissa that there's no audio on the live stream, so I just want to make sure that that's restored before we take any further.
Yeah.
Sounds on in here for sure, but there's something to connect it into the live stream, that button that may not be pushed.
Well, we'll just pause then until, and then we'll redo the whole thing. Just kidding.
Oh, Allison P. says she has audio, so we must be good.
Okay.
Okay.
Great. Thank you for the heads up there. For those who didn't hear our audio, we called the meeting to order and then had the election of board officers. Commissioner Mills was elected as chair. Commissioner Sullivan was elected as vice chair. We're now on item 3 for the approval of the consent agenda. That includes our meeting agenda, the minutes from December, financial report, year-end donations report, and the resignation of our adult and home and community-based services supervisor. Are there any items Commissioner would like to pull? Else I'd entertain a motion for the approval of the consent agenda.
Also move.
Thank you, Commissioner White. We have a motion. Is there support?
Support.
Thank you, Commissioner Sullivan. We have a motion and support. Any further discussion? Hearing or seeing none. All those in favor?
Aye.
Opposed? Motion passes unanimously.
Mr. Chair,
Yes, please.
I would just like to make a comment that folks sometimes aren't hearing us very clearly, and so we want to make sure that we speak a little louder for the public and even for ourselves so that they can hear and know what we're saying. So I would appreciate that.
Thank you. And maybe closer even as helpful. All right. Well, that moves us down to item 4, welcoming new staff. And I'll pass it right on over to Director McIntyre at this time.
Thank you, Chair Mills. Just a note on the consent agenda as well. I'm noticing that our donations letter didn't get attached to the consent agenda. So we'll bring that back before this board in February so that you can see and recognize all of the donations that our department received in 2024. And my apologies for that omission.
Thank you.
You bet. So really excited to welcome on board in the last month 2 new staff to the Public Health and Human Services team. Liz started earlier this month as our new licensor and community childcare coordinator. She comes to us with a great deal of experience in the childcare industry as an in-home provider and with other early childhood experience. We're also very excited to welcome Rose Downey to the Children's Mental Health team in a position that we have had vacant for over a year now. No, not over a year, over 7 months. And Rose also brings great experience from her previous role as the social services designee at North Shore Health. And welcome either of you or your supervisors to share anything else. No pressure.
Well, thank you for joining the team. We're very lucky to have you, and hope your experience here is fruitful and fulfilling, and looking forward to all the good work that you do. Thank you. Any questions from the board here?
Just gratitude. We appreciate you joining our organization.
Thanks for taking time out of your busy Tuesday mornings to come down for a brief welcome.
Yeah. Thank you. Looks like we're missing Hilja, but
Hilja's working a part-time schedule, so
Okay.
we may have just missed the,
I've met Hilja before, so.
yes.
All right, well, that brings us down to item 5, our director's report. Director McIntyre.
Yes, thank you. I have a PowerPoint to share, so I'm going to, I'll go over the screen. You all should have that on your screens as well.
Yep.
Okay. I can see that. So, this morning I have prepared a year-end report for the year of 2024. This is my 7th year in review for the board. I have also incorporated some elements of the new staff and new commissioner onboarding presentation that I give to all new staff in the department and new commissioners when they're coming on board. Since we have a new returning commissioner, I thought it would probably suffice to just incorporate some of that in my year-end report rather than do 2 separate presentations. I think the last year I did that was in 2021 when Commissioner Johnson was newly elected. So I will follow a similar format as previous years, share some staffing changes, updates to major projects that our department undertook in the last year, and some of the program development that we led or partnered with other organizations in the community on, and again, incorporating some of that contextual information about how we operate with other governmental agencies throughout. Really using both sides of my brain on this Tuesday morning here. All right.
And 2 computers to boot.
2 computers, yeah. So we'll see if we can advance the slides this way.
You may have to just click within the presentation window that's up. And so if you just, I think, slide straight up, I believe, or maybe it's, I don't remember if it's left or right.
Yeah, it's advancing on the computer screen, but it isn't
Mm.
up here.
Is it not what Is that when you have to like close it and reopen it maybe?
Could be.
Good.
Try it.
Not to advance.
We could just start the day over. Oh. That's a cool picture. Wow.
All right,
There we
thank
go.
you, Jana.
Cool. That may
Appreciate it, Jana, thank you. All right, thanks for your patience. So in Minnesota, the Public Health and Human Services system is state supervised and administered by counties, tribes, and nonprofit organizations. Mandated human services programs and the essential areas of public health are defined in state statute. Notable in 2024 is that the Department of Human Services was reorganized into 3 separate state agencies, those being the Minnesota Department of Human Services, Department of Children, Youth, and Families, and the Direct Care and Treatment Department, which isn't reflected here on this slide. So in addition to those two state agencies, we also have oversight grant funding from the State Department of Health. So in this structure in the state of Minnesota, the state agencies provide leadership in policy development, implementation, standard setting, training and technical assistance, information systems, program oversight, and performance monitoring and compliance. And the administration of services are delivered directly to the public by tribes, counties, healthcare organizations, nonprofits, and other community providers. All right. Locally, our governance structure is that we have oversight from this board, the Public Health and Human Services Board, which includes each of our 5 elected commissioners, and the citizen representatives of our two citizen advisory councils, those being the Cook County Local Mental Health Advisory Council and the Public Health and Human Services Advisory Council. Again, these councils are established in state statute to make formal recommendations to the department and to the board as it relates to our budget, service delivery, strategic goals, and priorities. Both councils provide input about services and coordination of care. They're involved in department service planning and make recommendations regarding services provided and reports to the board on a regular basis. Both councils are recruiting additional members, so as you are aware of constituents who are interested in becoming more involved in county government, we are welcoming new members to both councils. This is our 2025 organizational chart. No changes from 2024 to 2025. I'll get into quite a bit more detail on our staffing structure and staffing changes within the last year. Our department is organized into 3 primary areas, those being human services, which consists of 3 units or teams, public health, economic assistance and healthcare programs, and the administrative, fiscal, and support staff who work across all program areas. Breaking that down by team, our adult and home and community-based services team provides mandated services in the area of vulnerable adult protection investigation, general adult services, care coordination for older adults in long-term care settings or living in the community, developmental disability and intellectual disability case management, other waiver case management, and MinChoice's assessment for determining public program payment of services for people with disabilities and older adults. There are 7 staff in this unit. Non-mandated services within this team include the in-home support program. That is a state licensed program in which independent contractors are providing services to community members in the area of transportation, respite, homemaking, cleaning, and then our staff provides coordination of that program, ensuring that all of the standards are met and conducting the matching of residents who are requesting that service with the independent contractors to provide that service. Again, this is one of the few non-mandated services that we provide as an agency. This is an area where the department and the board has made an intentional investment in supporting older adults and people with disabilities to help them remain in the community due to limited services. Our behavioral health team also includes 7 staff who provide services and coordination of care for residents in the areas of adult mental health, children's mental health, substance use disorder, and co-occurring disorders case management. We also contract with Greg Barnier, who is a licensed alcohol and drug counselor who provides clinical services within the Wilderness Outpatient Treatment Program, again, a state licensed program where the county is a license holder. This is another area where we're providing a non-mandated service. Counties are not mandated to provide substance use treatment services, but without this service locally, the nearest place to receive that service would be in Lake County. This team has seen the most growth in recent years, Historically, looking back 10, 12 years, we had just one adult mental health case manager and one children's mental health case manager. We've seen significant growth in this area following the closure of the Human Development Center, which previously provided a range of mental health services and was supported by the county through a purchase of service contract. There are also new services available through the state through some of the substance use disorder reforms, including substance use disorder and co-occurring disorders case management or treatment coordination. Also, the mobile crisis, that began as a pilot program. And while we've struggled to staff that position, we are continuing to develop a more robust system. We've recently received state certification to be a certified mobile crisis response provider. So that service is also within this unit. In Children and Family Services, we have 5 staff providing mandated services and coordination of services to support youth and families in the area of child welfare, child protection, assessment, and investigation, and the Parent Support Outreach Program, which provides supports to help families maintain stability and prevent out-of-home placement. This board supported the addition of an FTE in 2024 to be able to respond to increased volume of reports and families needing that level of support within our community. Licensing, you met Liz this morning. She has stepped into that licensor childcare coordinator position. That again was a reconfigured position back in 2022, I believe, 2021, to add that childcare coordination function to that role. So Liz, as she learns the licensing world, will eventually be stepping into some of the grant and program management in the area of those childcare wage enhancement and childcare professional development programs. Currently, the supervisor is maintaining that during the onboarding process. Economic assistance and healthcare program staff determine eligibility and enroll residents in programs that help with basic needs, like payment of healthcare services. State and federally mandated programs administered by this team include a supplemental nutrition assistance program, short-term cash and childcare assistance programs for families, general assistance, and supplemental assistance for older adults and persons with disabilities. Since 2013, we've contracted with Carleton County to administer the Child Support Program. Other contracted services in this area include with AEOA, Arrowhead Economic Opportunity Agent, who provides the required employment and training services to families that are enrolled in cash assistance. Minnesota Chippewa Tribe also provides employment services to enrolled members. But the tribal employment services receives funding directly from the federal government rather than through our agency. In our public health team, we have 5 staff providing coordination and leadership across all 6 essential areas of public health statutory responsibility. I'm not going to list those all off right now. But we do have staff designated to some of those primary areas of public health responsibility, including infectious disease and emergency preparedness. And recently we've added another health educator. That position's fully funded through a state grant to provide youth substance misuse and suicide prevention services. So all of our work within public health is driven by those essential areas of public health responsibility and also responsive to the needs that are identified in our 5-year community health assessment and health improvement plan, which I'll say a little bit more about here. Contracted services, we contract out many of our public health services as a department, as a community, those being Sawtooth Mountain Clinic, are contracted to provide outreach, WIC, which is the Women, Infant, and Children Nutrition Program, family home visiting, and with North Shore Health for home care services. And in our structure, the Cook County Environmental Health Department is responsible for investigating public health nuisance. And at a state level, the Minnesota Department of Health has responsibility in Cook County for food, pool, and lodging licensing and compliance enforcement. Lastly, the administrative and fiscal staff are providing support to all areas of the department, including in leadership, coordination, customer service, grant, and contract management. Fiscal staff perform mandated grant reporting duties, receipt of federal and state funds into our accounting systems, estate recovery, billing for services provided by staff, and licensed program. And then our office support and case aid staff are represented again on this slide as they provide administrative support across all areas and then specialized support to our economic assistance and healthcare teams as there's a lot of systems, data entry, and scanning required for those programs. So what changed in 2024? We had 11 positions turnover last year. Out of those 11 positions, 6 of those were resignations. So 6 people left the organization in 2024 from our department, and 5 of those positions turned over because of internal promotions or transfers within the department. This is a slight reduction over the 14 positions that turned over last year, 2023. That was the all-time high for our department. And in 2023, 8 of those staff, so over half, remained within the organization as they were changing positions due to transfers, lateral transfers, or promotions. 2 positions remained vacant for over half of 2024, those being the Coordinated Crisis Response Worker, which was vacant from April 2023 to September 2024, and the Children's Mental Health Case Manager that was vacated due to an internal transfer in July and just filled recently by Rose, who you met this morning in January of this year. So how did we continue to maintain services and meet our mandates amidst this turnover? In large part, our existing staff accumulated overtime. So we had 2,047 hours of overtime or comp time paid out in 2024. The dollar value of that was $86,000. So of that amount of overtime, 33,000, just over 33,000 was overtime or comp time paid out. So in our pay structure, staff have to earn a certain amount of comp time, which they can use in lieu of paid leave. So they aren't really earning overtime until they hit that threshold of comp time earned. 53,000, so well over half of that total amount paid out in 2024 was paid leave or comp time paid out to staff when leaving employment. So again, another impact of turnover on this organization is that staff who had been unable to take time off due to caseloads and managing their workload, they may be leaving with a large volume of comp time or paid leave, which is a significant liability financially for the organization. In 2024, the board approved the addition of 2 positions due to the increased volume of reports and residents served through Children and Family Services, and with the support of competitive state grant funds to expand our work in youth substance misuse and suicide prevention. So again, those 2 new positions added in 2024 was the 3rd Children and Family Services Case Manager and the 4th Public Health Educator working specifically in youth substance misuse and suicide prevention. The health educator position is fully funded with grant funds, and the family services case manager earns revenue through their work, but it's not fully funded. So here is the breakdown, including the names of the wonderful staff that we welcomed to our team in 2024. Rocio Rivas, Lily Gruber-Schulz, Katie Page, Betsy Blaisdell, Kristen Peterson, and Marissa Eckel all joined our team in 2024. And another 6 staff took on new responsibilities within the department through promotions in 2024. Those being Isabella Sheehan, Leanne Avery, Laura Nelson, Nancy Deming, Ariel Charlier, and Marissa Chapman. So that is the end of my staff updates. I'm going to move into caseload updates. Any questions? Pause here and take a drink of water.
Mr. Chair.
Please.
Allison, on the, you just mentioned the family educator position, that they earn monies, which we have revenue sources in public health, human services, in the past sometimes are keeping up with the billing to get the revenues in, you know, for what's available to us was an important element of staying after. The other thing in your comment with the family educator, you said that position is funded in part by those revenue opportunities, but it's not fully funded. Have you had a chance to determine percentage as to the funding that comes as a result of the activity of that position, and how much then goes into the budget that is funded by taxpayers?
Yes, I can break that down for you as best as I can. It's a lot clearer with the health educator position, as that one is fully funded through grant funds. So that health educator, the materials associated with the program, service delivery, part of the supervisor time, all of that is covered by the state grant. So that's the public health educator. On the human services side, our children and family services case manager, these staff provide targeted case management and are able to generate state revenue for their time reporting and the work that they do with families. And I believe the breakdown, it's less than 50% reimbursed by the state. The reimbursement rate is a bit higher for our financial workers working in economic assistance and healthcare programs. Those are about 50% funded through the state. So it's a little less than that for the social services time study and targeted case management.
Okay, thank you.
I presented some of that along with the request to the board late last year. I showed historically the number of reports, the caseloads, the staff hours, and the revenue generated by that team. So I'd be happy to follow up with a link to that presentation so you can see some historical data on our revenue generation.
Okay, thank you.
You bet. Okay, moving along, more on caseloads. Across all social services programs, again, overall, across all human services, we saw a dramatic increase in individuals served from 365 in 2019, on the far left end of that chart, up to 647 in 2024. You can also see in blue and in orange the big breakdown of unduplicated clients in work groups. I'll say too, a work group is a case essentially within our social services information system, or SSIS. It's the system that we're required to use as county agencies. All other counties are reporting their client work. And this is also the system for billing, targeted case management. So across that time frame, we have historically had more adults in cases or work groups than children. You can see 2024, that breakdown is 491 adults and 156 children unduplicated in work groups in 2024. So again, while our department serves more adults than children, there was an increase in unduplicated children served. The increase from 2019 represents a 152% increase, from just 62 children in 2019 to, got to zoom in, that's a tiny number, 156 in 2024.
So that's, is that just about 10%, a little less than 10% of our population? Or I'm sorry, a little more than 10% of our population.
Another way to express our work in social services beyond the caseload data is through intakes. An intake is a call, a request for service, or a referral from another agency to our department. Again, this has steadily increased over the last several years, from 318 in 2019 to 509 in 2024. Of the 509 intakes recorded in 2024, 40 of those were within adult mental health, 42 in adult protective services, 167 in general adult services, 42 in chemical dependency, or what we would now call substance use disorder services. The state technology system hasn't quite caught up with the terminology there. 120 of those intakes were in the area of child protection services and 44 child welfare. What's the difference between child protection and child welfare, you might ask? Child protection is the category that we would give to a case coming in before it has been screened or assessed as to what service track or whether or not it meets the statutory guidelines for maltreatment. So child protection is a broader category, whereas child welfare would be services provided to a child or family after that report has been screened. Wilderness Outpatient Treatment Program, again, the county is the license holder, and we contract with Greg Barnier to provide clinical services. In 2024, there were 80 appointments scheduled for comprehensive assessments. Comprehensive assessment is a state standard tool for determining a substance use disorder diagnosis. 28 of those 80 appointments were canceled, where the individual didn't show up for the appointment. Just one of those cancellations was canceled by the provider, likely due to illness or courthouse closure, weather, or other factors. 52 comprehensive assessments were conducted in 2024, and 32 people received treatment coordination services through our substance use disorder and co-occurring disorders case manager, Brenda Port. Looking back to how this changed over time, in 2023, there were 62 appointments made and 50 comprehensive assessments conducted. So a pretty big increase in both the appointments and the cancellations and no-shows. About the same number of people received a comprehensive assessment in 2023 as in 2024. Economic assistance and healthcare programs caseload data. Caveat here, I did not update these numbers for year end. So this is the same data that was presented by Dagmara in November of last year. I can get the year-end data and include that as additional slides in an amendment to the presentation that goes out with the minutes. So in economic assistance, we're seeing an increase in households participating in SNAP, the Federal Nutrition Program. As of October, 136 households are enrolled in Cook County. This is higher than any other year in the last 4 years, with the exception of 2022. Where we are serving the most residents in this area is through healthcare programs. And we're seeing a pretty significant decrease in the number of households served through medical assistance, Minnesota Care, and Medicare savings programs due to the unrolling and unwinding of the pandemic-related waivers that were in place from 2020 until earlier this year. You can see the threshold there where the gray line, 2024, crosses the red line of 2020. So in April and May, we returned to those pre-pandemic levels of enrollees, with 559 households enrolled as of October. So I mentioned the Community Health Assessment and Health Improvement Plan earlier. This is our strategic plan as a department that drives our resource and staffing investments. It also serves as the categories through which we issue the request for proposals for the Public Health Fund each year. 2024 marked the second year of our 5-year community health assessment cycle. A lot of the public engagement was conducted in 2024 and 2023 as we developed the 6 priority health areas of affordable housing, mental health resources and support for well-being, affordable childcare, affordable quality childcare, transportation options, affordable healthy foods, and physical health services. The plan and the information on how we gathered community feedback to inform this plan is all posted on our website. So in the next few slides, I'll give a snapshot of our program development efforts within each of these priority health areas. So In the area of housing, our staff partnered with local agencies and led program development in the Healthy Homes program. This is a state grant-sponsored program in which our public health educators are conducting in-home health assessments and connecting residents who are eligible with grant funding to help mitigate some of the health hazards in their homes. This was year 3 of that grant program. In 2024, we also partnered with the Housing and Redevelopment Authority, or HRA, on an envelope pilot project to help connect residents with funds to address issues with their windows, siding, roof, and other parts of the envelope of a house. In 2024, we also partnered with Land Services on a well water testing program using grant funds to connect residents with well water testing. In the area of mental health, and again, this is just a snapshot, in 2024, our staff led the development of a prevention coalition to increase public engagement and inform our prevention efforts as a department. Harm reduction access was a major priority of our prevention work in 2024, with the addition of cabinets throughout the courthouse, emergency overdose response supplies at multiple county buildings, outreach on what does harm reduction mean and why it's important that everyone consider having access to these life-saving medications on hand. We also welcomed our youth prevention specialist, Rocio Rivas, in 2024 through that state grant opportunity. Rocio is leading efforts to convene a cohort of young adults in our community through the Young Adult Life Leaders cohort. Again, these young people will help inform our prevention efforts to ensure that they are responsive to the needs of young people. Coordinated crisis response program development was a major project in 2024. Recruiting for that position, continuing to build the infrastructure, including an electronic health record for that program. And in 2024, we also took over the facilitation of the LGBTQIA 2 Spirit Plus youth group, which is a weekly youth support group. And that's facilitated by one of our children's mental health staff. In the priority health area of childcare, our wage enhancement pilot was year 2 of that pilot program. And a number of child professional development grants and programs were delivered by our child care coordinator, Nancy Deming. In the area of transportation, 2024 saw the kickoff of the Boreal Partners Transit Project, in which our department used state grant funds to purchase an accessible vehicle that can be used by in-home support program volunteers as well as volunteers through Care Partners of Cook County.
Allison,
Yeah.
we might be behind on the slides. Or are you?
I forgot to advance. Thank you.
Mhm.
Forgot I have to do that twice. Thank you, Commissioner. Also in the area of transportation, a number of Safe Routes to School, active living initiatives, including the first ever bike rodeo in Grand Portage. In the area of nutrition access, in 2024, our department led the formation of a food access council to map nutrition resources and convene community members around access to healthy, nutritious, affordable food. And in the area of physical health services, a couple highlights of our initiatives include the Age-Friendly Communities Initiative in 2024. Cook County was recognized by AARP as an age-friendly community. And one of the priorities of those listening sessions included access to physical health services for aging community members. We also partnered with Sawtooth Mountain Clinic on a sexual and reproductive health program, which allowed us to increase access to services and, again, funded through a state grant. Some of the more internal-facing projects that our department undertook in 2024 was the implementation of a new electronic document management system. We migrated economic assistance and healthcare programs from OnBase, the system that we've been using for the last 10 years, to CaseWorks, which is increasingly the system that is being used by most counties throughout the state. And then we also moved from paper records to paperless records in social services. I mentioned earlier some of the substance use disorder reforms that are being implemented at a state level. How that impacted us locally is that we had to go through a process with the state to certify that we meet the American Society of Addiction Medicine's level of care, and also had to update our license with the state to indicate that we are able to meet the standards to specialize in the treatment of persons with a substance use disorder and mental health disorder. We were very well positioned to respond, as we had already added treatment coordination as a service within our department. Towards the end of the year, we began implementation of the Credible Electronic Health Records System. This will be the system of record for mobile crisis response and substance use disorder services. Our staff, Grace Grenager, was a participant in the Cook County Cannabis Committee, along with a few other members of the public health team, and as of the end of the year was co-chairing that committee. And every year we issue a request for proposals to local nonprofits to increase services in the areas of our community health assessment, and in 2024 we recommended the granting, or that subcommittee rather, recommended granting $190,000 in grant funding to those local organizations. Outreach continues to be a priority for our department, ensuring that community members know how to access services, what services are available, how to get involved with the department. So we've continued to push out information through social media, both internally and partnering with Todd Ford, the county communications coordinator. On a monthly basis, we're submitting articles to the Cook County News Herald, monthly WTIP interviews on Thursday mornings. Our department distributed or contributed to content to distribute 20 media releases last year, and are engaging with community members on a more direct basis through some of our advisory councils, the Prevention Coalition, Age-Friendly Communities engagement work. I like to include a reminder of how to connect with staff and services. You don't have to come to the courthouse to get services or to learn about what resources are available through our department or through other organizations. I also like to remind commissioners that if your constituents have questions or concerns, we have some specific processes in place from a state standpoint for rights for individuals to file an appeal or to report a grievance. So it's important to contact our department directly if you are aware of those concerns. We have a number of different ways to reach out to us via email, general information, and then email addresses that are directed to our intake worker of the day, both for economic assistance and social services. And that is it. It's a lot of information. Thank you.
Thank you, Allison. Questions from commissioners? I presume we'll be able to access this slideshow.
Yeah. Mm-hmm.
Thank you. All right. Well, if there aren't any questions, thank you again. Very comprehensive. And if there are any questions in the future, please feel free to reach out to Allison, and she can either answer the question directly or connect you to the resource that can.
Chair Mills?
Yes, please.
Just a comment for Allison. I wouldn't be surprised if once we hire a new HRA director, that there is a contact with you just to make sure of how the communication flows from PHHS to the HRA. And so I just wanted to advise you that hopefully sometime this week there may be someone reaching out to you.
Glad to hear that your recruitment efforts have been successful. Look forward to connecting.
All right, well, let's move on to 5B, staff updates, please.
All right, so I don't have much to share in my director's report. There's only been a few weeks yet of 2025, and that was my comprehensive 2024 report. So you met Liz and Rose this morning. They both started since our last meeting in December. Hilja Iverson is providing temporary support for one of our staff who's on leave. She's working with care center residents and community members who are receiving care coordination through one of our health plans for older adults. We're also working with a licensed social worker through the temporary social work agency that you approved contracting with in 2024. Tammy Matheson is on board with us providing temporary support to children's mental health, given the length of time to backfill the position and some of the complexity of the needs of families that we're working with in that area. We reposted the coordinated crisis response worker position following the resignation of David Ritmo in December. We had an interview on Friday of last week, so I'm hopeful to have a hiring recommendation or more information in the weeks ahead. And we also conducted an interview for the Children and Family Services case manager position following Lily Carlson's resignation. And again, anticipate making an offer on that position. Significantly, since our last meeting, we received the resignation of Martina Johnson, who is our longest serving staff member in the department. She's been with us for 18 years, providing services to residents of Cook County. Martina started with Cook County as a recent graduate of social work school, really had her entire career here to date. She served for 8 years as a social worker in adult mental health and was promoted to a supervisor in 2015 when the board approved the reorganization of our social services unit into 2 teams. Martina is going to be working for the state, so staying within the field in the Aging Services Division. So we wish her the best in her new endeavors. She is one of a number of staff who is making the transition from county to state agency work in recent years as the increase of telework has become more pervasive, and there are many more opportunities at a state level given the division of the agencies. And also want to be transparent with you all as the board that Martina did cite the stress of her job as a factor influencing her decision to leave. Any questions on staff updates before I move on? Okay. Again, not much to report in terms of agency updates for the first few weeks of the new year. The legislative session started last week. The governor's proposal was also released. The governor's budget proposal, that is, was released late last week. And that budget proposal includes many cost shifts to counties, specifically in the area of human services for the 2026 and 2027 biennium. So encourage those of you who are signed up for the AMC weekly legislative updates to take a look at the update that went out yesterday. Also want to let you all know that over the weekend, our staff were planning and preparing for the potential to set up an emergency warming house or shelter due to the prolonged power outages. We, in coordination with the emergency manager, sheriff, community center director, sent out a public notice to advise residents to contact dispatch if they needed a warm place to stay due to the prolonged power outage and extreme cold. We did not receive any requests for emergency shelter, so did not establish a warming shelter, but are recommending that we convene an after-action review process to talk about what we learned, what went well, and how can we ensure that communication and coordination is improved going forward. No major issues to report, but always room for improvement. That's all I have for department updates.
Thank you. Any questions for Allison? Looks like,
Just a comment on what a wonderful job you do and all of this. It's a lot of information and very clearly presented, and thank you for doing that.
Thanks, Rena.
Mr. Chair. Public health has always been a challenge. How to address real needs, to do it effectively, and manage the costs, and partnershiping so that we have revenues to be able to do that. One of the big frustrating things that we've always faced is when state legislatures or federal government mandate what we do and don't provide the funds to do it. And I'm of the opinion that if the legislators believe that this is an important thing, that they should find the funding to be able to support what they are proposing. If fellow commissioners have reviewed the AMC update relative to our present legislature and the governor's budget, we see that there are several programs that you've addressed that in this present budget the governor is proposing that we reduce our funding to counties by $200 million. So when we're looking at budgets, we look at what we know to be true based upon what we're responsible for and the present landscape, I would say. However, when we have these moving pieces and we've identified things that it's very hard for us to manage in this area, which is public health, human service, and the emotion associated with that in real people's lives. It is very frustrating when funding agencies that partnership with us mandate things and then withdraw the funding. And so it's early on in the process. There's a lot of chaotic maneuvering that is going on. But nonetheless, we're responsible for anticipating and trying to determine what are we going to do when we have burgeoning expenses in this area, when we look at what's mandated and we look at the funding that's being withdrawn. You look at the cannabis and the funding that was there, and so often the carrot that is held up is connected to a string that you have to look at. Is this good or is this not good? And we can't make assumptions that the funding that originates with programs will always be there, and this is certainly evidence of that. So it's something that's on our radar that we have to look at. And my position is that we should be proactive in addressing this with the legislature so we don't just take these hits to reduce spending elsewhere, and then our taxpayers have to pick up that burden. It's a real issue going into 2025.
well said.
Yeah.
Yeah, as much as we can participate in AMC, I think the better, because of the amount of advocacy that we need to do to the state legislature. And just
Mr. Chair, what I would say is that, I mean, the Association of Minnesota Counties, which is the collective of 87 counties, is certainly beneficial because our collective voice bears weight. And we identify our priorities, and when we go to the legislative conference, it's certainly an opportunity for us to do that. I always say we need to be forthright but gracious. I think in doing that, there's a responsiveness that comes that's healthier than if we just kick and shout and scream because we're not happy with what's going on. And so we need to frame our narrative in a way that respects processes but still emphasizes the importance of dealing with these issues. The statement, I think, that came out from AMC and Micah and Minnesota Rural Counties address is saying several of the governor's budget proposals represent significantly higher costs to county governments and property taxpayers, including changes that would create several new county funding responsibilities related to state mandated programming for Minnesota. The proposed deletion of local cannabis aid hampers county and city's ability to support complicated interactions with cannabis, licensing, zoning. So it's enough to deal with things on the local level, but the impacts of things that are happening that theoretically appear to be out of our control, we need to realize we have to do what we can to say this isn't fair. If you as legislators believe this is an important thing, find funding to put money behind what you're saying. So,
Yeah. Yeah, I agree. I also think, much like you referenced, Minnesota rural counties, there are other organizations beyond AMC, whether they be statewide or regionally, that can really bolster our voice with dealing with the statewide issues.
yeah, and Mr. Chair, what I would say in past experience as a commissioner is that up here in the Arrowhead region, if we have associations that are statewide, those certainly are beneficial, but it's difficult when the voice that is heard is the metropolitan voice that finds it very easy to head over to the legislature, and we're up here. And for the citizens, and even as elected officials or representative department heads, for us to travel down and have a voice and hope that we're given an opportunity to speak is challenging. So recognizing those things, it's how do we go about doing this so we don't abdicate our responsibility to represent our best interests at the local level. So.
Yeah. Yeah, there's a strategic planning session for DCYF January 30th in St. Paul, and for me to go down there and participate is really just not practical versus some of the other county representations that are closer. I fully expect their participation. That being said, the relationships that we've developed in these working groups, I feel like does us justice in that they can carry some of that. But still, I would much prefer to be directly involved there. Some of the virtual opportunities have helped, but it's not the same. So.
The nuance of being there, just facial expression and body language
Presence,
communicates sometimes more powerful than our words.
Absolutely. Yep. Yep. Thank you. That's all very well said. Any other questions or comments from commissioners? We'll move on to item 6, which is quite easy today. There's nothing there for board action. That moves us on to item 7, committee reports. We'll start with the Active Living Steering Committee, Commissioner White.
It was canceled because of illness.
Thank you. Move on to AEOA, Arrowhead Economic Opportunity Agency, Commissioner White.
The executive committee was canceled, but we did have a vote by mail on 6 different resolutions for supporting, or not supporting, Lake County Bone Builders, excuse me, for supporting Lake County Bone Builders Roundup grant for rental rehabs. This is for a number of different agencies, asking for AEOA's financial support to help them forward their projects. So I'm assuming that everybody was in favor of these different projects, but I do not know what the vote was, so, to the executive committee.
Okay, thank you.
And the next AEOA meeting is not until next month sometime.
And just to clarify, I was never on the AEOA Executive Committee. Are you? Oh, okay. I was going to
Well,
say,
she
good
reached
on you.
out. Well, she
yeah.
reached out to me and wanted to know, so I thought, oh, well, I guess I've moved up in life.
Well, I think it's a great position to be in if you are
Well,
available.
let me take this back.
Yeah.
She was asking our input to forward. I'm mistaken. I'm not on the executive
Right.
committee, but they wanted to know.
Yeah.
So the executive committee could actually do this, so
Okay.
I take that back.
Oh, no, that's what I
I'm
was-
not that special.
No, I was, that's what I was
Oh.
wondering, is if, I was like, wow, that's awesome, but thank you for clarifying.
Yeah.
Let's see, Arrowhead Health Alliance, Commissioner White? I saw.
We will be, we did not meet,
Okay,
we did not meet last month, and we will be meeting, having a special meeting next week.
okay, thank
And
you.
so, and it is, I believe, about the contract
Okay.
with the building.
Oh, okay, yeah. Is your impression that's,
It's been ongoing for quite a while.
but going
just-
okay, is that, or,
I think so.
Okay.
I kind of,
that's what when I left, that's the impression I had, but I just didn't know if,
right, and it's,
It's changing.
Center City owns the building. And they're looking at, it's like, how long will the lease be? And who is paying for what percentages of the operating expenses? So,
some of the details.
yes.
Thank you. Arrowhead Regional Corrections, Commissioner Campbell.
Thank you, Mr. Chair. When I was commissioner previously, I was on this board, and I can remember the first year, there were two of us, because it's rotating, so that the county rotates, and smaller counties can have two representation, otherwise the larger counties have more representation on that board. So that first year as a commissioner, I was on that board, and Commissioner Hall was also on that board. At the end of the year, the executive director said, we want to thank Commissioner Campbell for his service, and I had no clue that I was going to be off that board. There was no heads up kind of thing. So I felt a little bit awkward. The reason I say that is simply because Commissioner White this year is also, because it's our year now to have two, and so she was present as well. And we had our regular executive board meeting, and then we had the advisory board that followed. And our focus is on a presentation that was done at the advisory committee on recidivism, which is how likely is it that an offender going through the program would reoffend. And just quickly on that, if there's information that people would like to know specific, there was a PowerPoint presentation. But I think what's important, probably to the board and to the public, is that in 2021, there was a 64% incidence of recidivism, reoccurring, it could be a number of different things, felony, gross misdemeanor, or misdemeanor offenses. So 64% in 2001, and we've seen a decline that's taken place ever since about 2007. And our 2020 statistic, based upon this report, was down to 19%. So we've seen a drop in that, which simply means that the programming is effective in trying to prevent the reoccurrence. So I'll just say that if there's any questions particular, this report is available that outlines it more specifically. The other thing that was brought up to Commissioner White and myself was NERC's program for dealing with substance abuse. And Commissioner Johnson had been part of this conversation, and in the vote that was taken as to NERC's response to ongoing opiate abuse was to introduce a program, the use of Sublocade. And Sublocade is an injection that is given that it's a prescription injection used to treat moderate to severe opioid use in adults. And initially in the budget that was presented to us that we get from ARC each year, the cost for that was built into the budget, but it was determined that we should pay if we use it, meaning that the counties that participate in ARC, if in fact you have individuals that are in the program, if they agree to, because it's voluntary, to use Sublocade as an injection to help with the opioid abuse, that the counties will be billed. And so the injection is about $2,100, I think, and the vote that was taken, that Commissioner Johnson, agreed to that. My question, has there been any discussion on the board on that as opposed to affirming that vote? Most counties are using monies that I believe the state had provided. I don't know if our substance abuse disorder program, if we had funding that was granted, and those funds then are the funds that other counties that are in Arrowhead and the corrections program, they're just taking those monies to pay. So I think that at some point we should affirm that agreement, that we, along with the other counties, agree that you can go ahead and bill us, and which department will be billed should we use this. To date, we have not had anybody. And so I do have, let's see, the ARC board passed a resolution which reduced the ARC budget, as I mentioned, by $50,000 that had been budgeted for Sublocade, and they stipulated that they would bill the individual companies or counties. So we would respectfully request that we be permitted to invoice Cook County if and when we have a Cook County NERC resident receiving Sublocade, and which department would you like it billed? And they showed the history since 2020 through 2024, that we really have had very little use in that regard, and this program is a new program, so we don't really anticipate it. But should we have an individual in the program that chooses it voluntarily, then we would be billed. So at some point, I think we should just reinforce Commissioner Johnson's support of that. That's all I
Actually-
have, unless you...
Please.
And for the community, the other option, if not the injectable, would be a daily pill medication, which has its downfalls because you can't be certain that the medication is actually being swallowed when it's being given, I'm told. It takes a lot more time, and for efficiency, it does the same thing, but it's a daily pill that has to be dispensed. So that's the trade-off.
Commissioner Sullivan?
I just wanted to, for Commissioner Gamble's sake, indicate that we had spoken about this and had agreed as commissioners that we thought this was the best route to take.
Thank you. Then my recommendation is that it be communicated how we determined that should be billed.
Yep. And Director McIntyre, you had your hand up too.
Yeah, I was just going to add, my recollection of the conversation was that there was broad support on this board for that request, and that the funding stream that we would utilize would be the opioid settlement funds, so the funds that we're getting from opioid manufacturers, and that this would be in line with our funding strategy that the board has approved thus far of saturating the market and community with overdose prevention medication, and this would be in line with that as it's supporting residents.
And
We're
Mr.
incarcerated.
Chair and Allison, and so was it determined then where that billing would go?
My recommendation would be that if this is the board's direction that they'd like to take, that invoice come to the Public Health and Human Services
Okay.
Department.
All right, and that's what the other counties basically said, we're just going to take it out of that funding. So I'll just communicate, ARC has had a change in leadership through retirement, individuals that were there when I was there previously, and I had the opportunity and actually the privilege of interviewing the present administrator and on the personnel committee. And I was very impressed with her, and she's moved her way up to now be in that position. Very capable, very passionate, and very competent individual. So she's doing her follow-up and making sure that we're communicating and have everything. So I appreciate that. I'll just communicate that. Thank you.
Thank you. Just one question I had. I'm very happy to hear the report on the reduction in recidivism. one of the things I've learned about through AMC, and I apologize for not having more information locally about the meeting, was just the restorative justice program. I didn't know if ARC or NERC had strong ties into that program, or if it's still more of the fringe situation, or I know they have their own programming, but just
Yeah.
I was hoping
Yeah.
there's some kind of integration there.
I can't answer that
Okay.
at this point, but what I would say is that certainly the connection between the boards that commissioners sit on and things that we have locally, that we're always stronger when we link those resources. And in some cases, if there's redundancy, then we can try to figure out a way to do that, which reduces resources of people's time and dollars,
Yeah.
but doesn't abdicate the responsibility of meeting, what we're focused on as far as need. But I can ask about that, but at this point, I'm too new into it to know
Yeah, and I
how
think
much
it's.
communication is going on.
Thank you. And I just like to spread that word more. My understanding of the program is it's restorative justice is largely used before, hopefully long before it gets to ARC.
Yeah.
But just having that, awareness and
Yeah.
getting that word out, I think
Yeah.
would be helpful. So,
On that front, that Northern Counties Land Use Coordinating Board, that in that transition, that Grand Portage wants to be sure that they are, part of that process of discussion for things that affect them. And so I've had discussions with Margaret and look forward to, I sent her the schedule for the year, and I will discuss that. And given the previous experience, the N Club board was certainly welcoming, and I think that's the other thing, is just saying if there, like to your point, if there are other interested organizations that have the vested interest, that we want to include their voice so we have that perspective, so.
Thank you. Childcare Solutions Subcommittee, Commissioner Storley.
We'll be meeting in February.
Okay, thank you. Community Health Board, will be meeting in February. Local Advisory Council for Mental Health, Rana.
We met, but I don't have my notes from it, and,
I could
Yeah,
share
can you
just a
tell us
couple
that?
highlights. It
Okay,
was
sorry.
a brief meeting. There were a number of members who were not able to attend, so we did not have a quorum and weren't able to have a vote on officers for 2025. We'll be addressing that in February. Let's see. Andrea Orest shared that she recently completed a milestone in training as a prevention professional, and Rocio also went through that certification, so kudos to those staff for expanding their skills and education in that area. I could share a bit more detail on the Young Adult Life Leader cohort. That's a newly established group of local youth aged 16 to 18. We have 4 participants. This is a peer educator model designed to give teens the training, experience, and competence to talk to their peers about mental health and how to use 988, the National Suicide Prevention Line, as a resource. Public health staff distributed a survey to other organizations in the community that serve youth to help inform our prevention activities, ensure that we're best meeting the needs of young people in our communities. The Cook County Prevention Coalition continues to meet on the 3rd Tuesday of every month at Higher Ed with a Zoom option. Our next meeting is this afternoon. Andrea Orest is the lead for that meeting. And we are talking about adding that to the list of committees that are on the Public Health and Human Services Board and having a commissioner designee for that group. So I'll come prepared to our next meeting with a request for the board to have some discussion on designating a commissioner to that group.
Thank you. Commissioner White, anything you wanted to add?
No.
Okay. Let's see, restorative justice, as I mentioned, I was unable to give Commissioner Gamble any meeting info.
There wasn't,
maybe you found
we
it?
haven't met yet.
Okay, thank you.
I can give an update on that,
please.
Commissioner Mills. The meeting was canceled this month as all of the staff were participating in a training in Grand Portage, January 10th through the 13th, and I had the privilege of participating in that training as well. It was a restorative justice circle keeper training with Kay Pranis, who is an international trainer in restorative practices, and it was really a gift to be able to be a part of that.
Thank you.
There's a big state grant pending for restorative justice to provide some ongoing stable funding and continue on with development of that program into a North Shore initiative. So Cook and Lake counties are partnering on this.
Great. Council on Aging, Commissioner White.
Nothing new to report from last week's.
Yeah. Okay, thank you. Emergency Preparedness Committee, Commissioner Sullivan.
So if you'll recall, we had a combined meeting in November and December for that organization. But just an update on something you may have heard in the media. Our Emergency Management Director, Mike Keyport, is working closely in the area of radar. And one of the things he's attempting to do is work with other emergency managers in the state of Minnesota to eliminate the radar gap that we have here in Cook County. Radar is impacted because of the curvature of the earth, and there's a large portion of Cook County where you can't find out about precipitation, high winds, storms that are at a lower elevation, and it really impacts public safety. And so Mike will be working with other emergency managers to ensure that there's some funding in the state of Minnesota, and this is one of the things that we know there is an appetite for at the legislature. So we will be testifying there, and that was mentioned at our commissioners' meeting last Tuesday. Mike Keyport will be coming out to the airport to talk with the airport manager, because one of the potential sites is the Cook County Airport just north of the Devil Track Lake area. So anyway, more to come on that, but a lot of conversation about it, and it would definitely benefit the public and the visiting individuals who come to Cook County. So we'll look forward to hearing more about that in the future.
Thank you. Has there been any discussion about just flattening the earth?
No discussion about that.
There
No
was-
discussion about that.
Quite some time ago, there was a discussion, but it wasn't around.
Actually, the discussion right now is, do we do it at the airport? Should it be northwest of the airport? Should it be east, closer to Hovland? And there's lots of possibilities. So it's a matter of getting experts up here to actually look at the topography and the terrain that we have and determine what would be the best location
Yeah.
for that device. And it's, there's one currently at an airport in Minnesota. The other handful of small radar units they have are on top of water towers. They're about 100 feet tall. They're not real significant in height, but the main thing is you want them in a place that does provide benefit.
Commissioner Mills, if I may add one more update from emergency preparedness before
Please.
we move
Yeah.
on. Andrea Tofty, who is our department lead for emergency preparedness, is working with a designer through the Community Health Board on a magnet project with safety tips for extended power outages. The idea is that this would be both for residents and for people visiting and staying at a vacation rental, that they would have readily available phone numbers and some basic tips on what to do and who to reach out to for help.
Thank you.
Yeah.
It's a great idea, especially for the high number of vacation rentals we have. Healthcare Planning Committee, Commissioner Starley.
We did not meet this
Okay.
month.
Anything from NACO?
Yes.
Okay.
So on January 3rd, the 119th Congress began. And as of yesterday, we have a new president. There's a lot of things happening in NACO who come before many legislators, senators, representatives to represent all of us in the 3,050 counties that I meet with every month. I would say there's going to be some major changes. One of them is going to be with the Medicare telehealth, and I don't know if anybody's been able to participate in a telehealth conference with their doctor, but evidently they're, depending upon your geography and original site requirements, it's going to be looked into quite steadily later on this spring, and probably not till after April 1st. But more to be reviewed on that. I know that the money for that is lacking, and so that is the reason for more looking into how they can help. And maybe we're in a good geographical place. Maybe we're good to be on a curve because of where we are in northern Minnesota. We'll have to see. There's going to be Medicaid cuts. And according to Allison this morning, our Medicaid folks here, probably in Cook County, will be affected. There again, that won't be discussed for a while, but right now on the table will be 2.3 trillion cuts in Medicaid. But it's just right now on the table to be discussed. So we need to keep our ears and eyes open on that. There are a lot of other funding that's going to be available, but I'm not going to go into those details because they don't happen until the end of this month, February, and the end of March. So by next month, maybe I'll know some good news about some of the funding that would be maybe like behavioral health, workforce education, and training programs. You know, that's an important thing. Healthy Tomorrow Partnership with children's programs. And speaking of children, we had an extensive conversation about social media and how social media is affecting our young people from, I don't even want to know how young. I'm hearing 5 years old up through high school. And one of the things that wasn't on that, and it doesn't affect the younger people, was gambling as a social problem. So we kind of touched on it. I think there'll be more said next month when we reconvene, but each time I am part of this conversation, I'm always amazed at what other people bring up, and I'm saying, oh yeah, it affects all of us too. So we'll hopefully have better news next month. We'll see.
Thank you. Yeah, I have a friend who I learned spends $40 a week on e-tabs, which blew my mind. Supposedly a break-even situation for them, but it's just more than I think is healthy, and but it's not my judgment to make. At the same time, another, I guess I'd call a friend, who said they just lost $800 on one of those e-gambling devices, and that really alarmed me, to say the least. But I know it's more accessible, and it's a part of the whole addiction psychology, and it's of course it's an issue right now, but my understanding is that issue is increasing as well. So it's something we should be aware of.
Our state really hasn't said anything about legalizing the gambling for online gambling and all of that, so we have to wait and see what they do too in the state to make it even more viable for people.
Mr. Chair,
Please.
On that topic, gambling, we had a resident, and in talking with the family, because the resident passed away, the amount of money that individual spent in gambling was, it's crazy. When we look at its effect on young people, whatever is happening in the culture that becomes acceptable and takes priority and in focus, those of us that are sports fans that have followed sports year after year, the incidence of gambling and everything in the dialogue nowadays is talking about over and under. We're not talking about who's got the strength in the running back position or the wide receiver. The focus on gambling because it is such a moneymaker. So my point is that if the culture has given profile to these things, it can't help but shape the thinking of everybody, young people and everybody. But it's interruptive to what we used to enjoy because of the occurrence of it is just unbelievable. And everybody's getting in on it because they see it as an opportunity. And what's so short-sighted about that is the effects on people's lives. You can make the money, but what are you doing as a society when we make these things so prevalent? It's just part of the culture. Everybody does it. So consequently, where is the right or wrong and what's good for us in this decision?
Commissioner Mills?
Yes, please.
Does anyone know, I was watching football, right? And all of a sudden, as Commissioner Gamble said, it's all over, like you can play, you can, punch in this number. Now, when did that become acceptable? I mean, I don't recall that happening last year, watching up to the Super Bowl. But all of a sudden, we are awash with that on the football games.
Yeah. Mr. Chair, Commissioner Mayhew,
Yeah.
it's, what happens in some of these things is that there are people that have vested interests that push legislatures to open that up. It can be a number of different things that we've seen that all of a sudden, as a society value, we protected it. And then became lax, and then people that have a vested interest influence, and so then legislation gets compromised, and it opens the door. And once that door is open, then everybody gets on board, and that's the problem. So wisdom and discernment says, we need to see what's really happening. Do we really want to do this because of the ripple effect? But yeah, it's unbelievable now how much we have to put up with the pushing and pushing and the incentivizing through, you'll get this much money if you da-da-da-da-da. It's crazy.
Commissioner Mills? And once upon a time, gambling in sports events was illegal because of the possibility of, corruption, of someone throwing boxing, like someone throwing a punch or, taking a fall or, and now we don't care anymore. I'm sure somebody got in with enough power and they're gonna make money, and that's where we are.
Yeah.
Changing culture.
It's very alarming, to say the least. I'm sorry, back on track here. Northeast Minnesota Office of Job Training, Commissioner Gamble?
Haven't met.
Thank you. North Shore Collaborative, not yet met. I believe that's in February here. PHHS Advisory Council, Frank's not here today. I don't know if you have anything you'd like to report, Commissioner Gamble, or if Allison.
Which one?
I'm sorry, it's the PHHS Advisory Council. And maybe
Yeah.
that did not meet either.
And Allison can jump in here too, but it was my first meeting and an organizational meeting, and so there was a significant discussion about how we, our policies, our bylaws define, how we determine our leadership. And so that was, like I say, a significant part of our discussion. Allison, anything else then?
I'm just going to pull up the notes and see if there's anything to mention here beyond Commissioner Gamble's report. We're going to have we'll have a new representative from the hub. Jess Rodney will be stepping into
Oh.
that role, representing the board. We had reports from Grand Portage Health Services on the Violence Prevention Center, as well as Sawtooth Mountain Clinic. We had some technical difficulties with the virtual. For some reason, that's what's standing out to me right now.
It's been considerable trying to figure out how to, all this new technology. It's just better to show up on your horse and come in.
Similar to the local mental health advisory council, we did not have full enough membership represented at our first meeting of the year to have an election.
Sure.
So that'll happen at our March meeting.
Okay. Okay. Moving on to the Food Access Council. That was my first attendance with this group, and I was there virtually. It was held at higher ed. There was a fair number of people attending virtually, so I think there was appreciation for that option. Also, attendance, good attendance at higher ed, and just I'd say it was a lot of strategic thinking and kind of looking at the mission vision of the group and what people are hoping to accomplish, and just a lot of good discussion. And so this council had a number of meetings prior to this, and so there was some history that I was just kind of catching up on in discussions, but a lot of discussion around Ruby's Pantry and the future of that, the importance of that, and the service that it provides to the community, as well as the food shelf and Northland Food, and just kind of how everything comes together, and the opportunities for efficiencies there and collaboration. One of the points that was brought up a number of times was just the quality of the food and issues there, and how it's believed that is driving some lower participation in particularly in the Ruby's Pantry program, and there's broad agreement about that, and that it puts the whole program in jeopardy, because with the lower participation numbers, there's a minimum, and I'm sure you've seen this in media just about the ins and outs of that, but it's largely out of our community's hands as far as, I shouldn't say largely, it's entirely out of the community's hands as far as what is brought in from Ruby's Pantry. So there's frustrations there, and as I said, the need is still there. So the fear is that the people who are hungry and the people who need sheer calories are going to be impacted the most if those who have the luxury of choosing to participate or not are not participating. And so just trying to work through options and opportunities there. Collaboration with farmers was discussed. It's not a huge, there's not a huge number of farmers in our community, but it is a passionate number of farmers, and trying to integrate some of the locally produced food and what we do have in our community, and just what is happening in Grand Portage, and trying to fit everything together. So it was a really good conversation, and I'm really excited to be a part of that. Hoping we can find some better solutions immediately as well as the long term. So learned a lot, and yeah, be excited to report more.
Yeah, please, Mr. Chair, thank you. As Allison identified in her report, healthy food options. And we have had participation with Ruby's Pantry before Ruby's Pantry had actually begun. I had researched and talked with the individuals who orchestrate Ruby's, and trying to identify need up here, whatever else. We met with a number of people and whatever, and then we began. At Harborview, we had sponsored shares so that we would pick it up all the time, bring it over there. That sponsorship ended, and we do have new sponsors that are going to be sponsoring it, but as a result, we've had the overflow brought over. And so I communicate with them, and I had that discussion this past week that we are required to have 160 shares, and right now we're at about 100. So we're picking up that tab and paying it in order to keep it coming. But as you said, that part of the problem is that if the quality of the food isn't there, then the individual isn't going to want to pay the money because they don't get the options they're looking for. And so I think that they're, given who Ruby's Pantry is and their, I'll call it mission, that I think they're certainly receptive to understanding that. If foods have been diverted because of needs elsewhere, because of things going on, but they still want to fulfill their commitment to other communities, that might be part of it. If we understand that, then we can say, well, we've got to find a balance in that regard. But so my wife went over to pick up all of the extras this last Ruby's, and there was a box of hamburger buns. They were so thrilled because everything was gone. So it might be that we're seeing that people, because of need or something changing, that participation was up. They were just so happy. So hopefully that trend will consider. There's no question that the need exists. It is to the issue of what are we getting for what we're paying. And so it's commendable that in the community we're picking up the difference in order to keep it coming. But the ultimate is to get it working the way it should work and meet the need that exists. So.
Yeah. I appreciate that
Mr.
insight
Chair.
there too. Yes, please.
Yes, there was a social blast for that, and it really helped. So that you need 150 participants, and it was 144, and so they filled it up, and that's why you got hamburger buns.
Yeah.
only.
Yeah.
So.
Yeah, I think
You know.
communication is a
Yeah,
huge part of
it
that.
is.
Yeah.
It is.
Yeah.
Yeah.
Well, thank you, and yeah, again, I'm learned a lot there, and very excited to learn more and to try to connect all these parts together. And if there's ways to supplement one program or another with whether it's different food or higher quality food or whatever is needed, there, of course, everyone's heart is in this. It's just connecting those dots and seeing what we can make happen. And maybe it's just sheer communication that was the missing part. But I think, there's that quality issue. And
Yeah.
But I really appreciate the
Yeah,
perspective.
and Mr. Chair, I would say too, in looking at this, we know on radio that there are community service, spots that you have to comply with enough of those things. In our local publications and things, our newspapers and whatever that come out, maybe if we had a conversation in that regard, that there could be something that is uniform visually in format that people become accustomed to looking at to see options relative to food source within the community. And it even can be like the farmer's market or whatever takes place, any place where you have options for food. And the more that we communicate that, I think the more, we meet the need because people become aware. So, I think it's something we should talk with different media about their willingness to do that if we were to put that together. So,
Yeah. I'll bring that up with the next Food Access Council meeting too.
Yeah.
Thank you. All right, I think that's brings us down to the good of the order. If there's anything else Commissioner would like to bring up, Commissioner Storley, please.
Thank you, Mr. Chair. I'm wondering about Frank's position, if that needs to be filled.
Is he, I guess I'm not aware.
I can update the board on our discussion at the meeting in January. We discussed whether there was interest among the council for serving on a leadership position. Frank indicated his willingness to continue to serve, but recognized that he wasn't as available as he would have liked to have been in 2024, so wanted to offer it up to other community members on that council. We talked as Commissioner Gamble indicated, about our bylaws and whether or not those are unnecessarily prohibitive of including new members and the length of service requirements prior to serving as an officer. We talked as a strategy of removing language in the bylaws as they're written that the vice chair both the chair and vice chair have to have served a year on the council before becoming an officer, and we discussed the possibility of making a modification to that so that the vice chair could serve a year as the vice chair with mentorship from the chair, even if they don't yet have a year of service on the council, so that they could earn that with the intention of moving into the chair seat in 2025. But the council didn't make any formal motions or recommendations, so I expect we'll have an update at our February, if not our March, Public Health and Human Services Board meeting in terms of any bylaw changes and whether or not we have a new chair.
Okay, thank you.
Thank you, Mr. Chair. In that discussion, my encouragement was that we look at our bylaws and whatever informed that policy initially, that we understand that moving forward. Because if we find that we're in a particular year where it's hard to find people that are willing to step up to that position, the first thing is to communicate what the role and responsibility of the position is. And as Frank said, there's really not a whole lot that you have to do as vice chair. It's just if I don't show up. But because of the concerns, and Frank had said this, that he can't show up as much as he really wants to, and so we emphasized that the vice chair would understand in that role that they would step in when the chair couldn't do that, so that the representation would be at this meeting. And so it was something that was noted. It was just we should step back and take a look at our bylaws, and we don't want to have a knee-jerk reaction if in fact we don't find a pool, if the reason that we wanted to have the one-year tenure before they can move into the chair position, that it might be, if we do make a change in that regard, important to emphasize that part of it is that the chair will mentor in that year that vice chair, so that they would be prepared even though they hadn't had the year prior to, and that we would have the representation on the board here.
Okay, well, thank you, and yeah, we'll stay tuned for next month and see what we find out. So, anything else for the good of the order? Well, for not having any action items, we sure used our time, but there was excellent discussion, and I really appreciate everybody's input. And we have our 10:30 Committee of the Whole meeting coming up, and we're at the end of our agenda, so I'll call us adjourned. Thank you.
Thank you.
What's the format of the Committee of the Whole?
So we're going to take the chairs
After the committee of the whole.
and put them in
Yes. Yes.
conversation.
I'm going home.
Yeah.
Like I'm